Welcome to Coding for the Rest of Us. I'm Lindsay Coates. I'm here with Mary Pat Whaley, owner of Manage My Practice and a fellow of the American College of Medical Practice Executives. Welcome, Mary Pat.
Thanks so much for having me.
Excellent. So let's get started. Many times in practices, there are silos built with job descriptions. So why should everyone in the practice have a basic knowledge of coding?
Well, when all the pieces know what the big picture is, it's a much better result. When each little department or even person only knows what their piece is and doesn't understand how their piece interacts to make a good result, then it's much less satisfying and people aren't motivated to do things well. When they understand that they're a very important part of the whole big picture and they understand what comes before their piece and what comes after their piece, then everything is going to go much better and they're going to be motivated to do it well.
Excellent. So let's get some hardcore examples. What about the scheduler, front desk admin, the checkout staff? When would they need to have coding knowledge?
Well, probably one of the most important things is knowing when the patient was last seen in the practice. There is a rule that Medicare uses and many other payers follow where a patient can only be considered a new patient if they haven't been seen by a provider with the same tax ID number in the past 3 years. The idea being that if you haven't seen a patient for 3 years, it's going to take more effort and documentation to get up to speed on what's been going on with the health of that patient. And so one thing is important that the front desk understands, and the checkout as well, is when are patients considered new or established patients. And that's something that is very easy to facilitate on the front end by checking to see when the last time the patient was seen face-to-face. If the patient's been calling in or getting lab tests but hasn't been seen face-to-face, they're still considered a new patient.
Okay, so it's important for these positions or in-house staff to notice those types of things.
It's also really important for everyone in the practice to understand about the fees, which relates to the coding, because as we know, everyone right now is having a hard time financially, and charges for medical services are coming into question all the time. I think it's important that everybody in the practice understand that for the most part, kind of the gross charges or the retail fees are not what ends up being paid. This is a pretty complex topic, but one that it's really worth educating your employees about so that they feel comfortable, they're not embarrassed for what the practice charges.
I gotcha. So what are some of these basics that all employees should understand?
I think all employees should understand the difference between service codes, which are CPTs, and diagnosis codes, which are ICD-9s. I think it's very important for everybody to understand that the service and the diagnosis codes are attached to the patient visit and actually to their medical record forever. So it's extremely important that they be correct. This is something as we get more and more into shared medical records and electronic medical records across lots of different systems and communities and even across the United States. Everybody has to understand that incorrect diagnoses can and have haunted people for years and made it difficult for them to get life insurance or later to get medical insurance. So it's a very serious thing. It's not just how we get paid. It's identification that follows the patient forever. So everybody should understand how really critical this is.
That's a really good point, seeing it from the patient side of view. So what can the office manager or the practice owner do to facilitate everyone learning this throughout the practice?
I hope that practices are all having monthly meetings, and it's great to devote just 5 minutes to every monthly meeting to a little snippet about coding and understanding. If you don't hand the encounter form, you may not understand why it's important that the information on the encounter form be correct. If you have patients asking questions about, well, why did the physician choose this? Or why is it $100? Last time I was here, it was $75. if the whole staff knows and is educated a bite at a time in staff meetings, they can answer patient questions more comfortably. So I think, and this is a great role not only for the manager, but also for the coder or the biller in the practice to kind of step up and say, this is just a bite at a time. It's great when the whole practice knows the answer to a question and you don't have to say to a patient, oh, I don't understand anything about billing. You'll have to talk to our biller or our coder. It's great for the patient to feel like they're going to get the same answer from every person, and it's very important for the efficiency of the practice.
Kind of like a unified front coming up with all the answers. I like that. So what's the best way for all employees to keep up with the coding changes and payer rules? There's a lot of changes every year. What should they be doing or going to?
I think that it's really important that there be a central information repository in the practice that all staff can go to and know that that is the very latest information. Now, this could be a shared file on a server. That's probably getting a little more outdated these days. More practices are going to their own in-house wikis where the information is kept up to date, or even an information repository on the cloud, like with Box.net, which is what I recommend to people. So staff can always find the latest information and can also help update the information and be responsible for how current that information is.
Okay, and so even if a practice outsources their billing, which a lot of practices are doing, what are some of the tools that they can turn to learn more?
I think it's really critical that if your billing is outsourced, that you view the billing staff as just an extension of your own staff, like off-site staff, and not take for granted that the things that the information that's being shared in the office is also being shared in the billing company. You can also compare, information with the billing company and ask them to take responsibility for keeping your staff as well as their staff updated. I think doing regular quality assurance checks on some of the issues that are going on with coding to make sure that an outsourced billing staff is doing things right and doing the right things is very important as well.
I'm sure a good claim scrubbing software would be a big help too.
Absolutely. But you have to remember that it has to be very specific to your area. So you have to make sure when you're using claim scrubbing software that it has your LCD, your local coverage determinations, and that it's following the guidelines for your Medicare administrative care, your MAC or your FI, whatever you want to call it.
Excellent. So any final thoughts that you have for us today, Mary Pat?
Well, I think that when you say coding isn't just for the coder anymore, that everybody needs to know a little bit about it. I think that it's an acceptance on the patient's part of what the practice's responsibility is, and that it isn't just one person's responsibility, it's everybody's responsibility. Things are going to continue to heat up with healthcare and patients. Consumer patients, I'm so glad, are taking more responsibility about finding out about things, not only medical issues, but also payer issues. And I think that's the best of all worlds when the patients are empowered to ask questions. So I think it's a little scary for some practices, but I wish they would all embrace it because it's the way the future's going to go.
Absolutely. Advent of the internet. Well, thank you so much for joining us today. I really appreciate it. And I hope everybody tunes in next month for our medical practice management podcast series. Thanks.